Hey, Gina, yourself. Tell me what is your position title? What are you?
So I'm currently a clinical director for emergency department and hospitalist services.
Okay, and how long have you been doing in that, or how long have you been in that position for?
In that role, it'll be 2 years in
Yeah.
January.
Wow, how long have you been in like the whole medical field?
28 years.
28 years. So what were some of the steps from like the beginning towards now? Like where did you go to school? What was your first position? How long were you there for? Kind of thing.
Yeah, I think for me, jumping into healthcare started when I was very, very young. My mother was a registered nurse in an emergency department, and she came home telling us all the different types of patients she saw and different scenarios. And that was like our talk at the kitchen table every night during dinner. And so I was very intrigued with getting into the healthcare as a young child. Ended up doing candy striping in high school, did some volunteer work, and then eventually graduated high school, went to an associate degree program at one of the local colleges, got my associate degree into nursing, passed the boards, went on to get my baccalaureate degree at a local college, and then eventually ended up with a master's degree.
Wow. And how was schooling for all that? What was it like?
Schooling was great. The associate degree program was spot on. I just love associate degree programs. You know, they really focus on the clinical aspect of nurses. So there's a lot of bedside clinical time where you really can hone in and learn your skill. The baccalaureate degree is a lot more focused on leadership. And then depending on what program you choose for a master's degree, that will really guide what kind of field you're really studying. I did nursing leadership for my master's degree.
What was it like growing up with a mom that was in healthcare? Like, did that have any kind of impact in why you wanted to go down into it?
Yeah, I mean, your mom's an ED nurse. It's super cool, right?
Yeah.
She gets to see all the complexities of people in that type of environment. So it really just inspired me that I wanted to definitely go into emergency nursing. I ended up working in trauma, which is a little bit more than what my mom did. And that was super awesome experience, just working in the trauma environment and being able to help those types of patients.
Okay. So were you always someone that like had a heart for people? Like, did you know like this is what I want to do? Or was there anything else that was on the table of like, oh, I might want to do this or something like that?
I definitely knew I wanted to go into healthcare. I just really like the aspects of healthcare. I really thought I was going to go into medicine. That's where I thought that I was going to lead or end up going into. But after talking to my parents and really looking at the different aspects of nursing, I mean, there's so many fields in nursing that you can go into. So I decided to follow in my mom's footsteps and got into nursing.
That's awesome. What other like aspects of nursing, like what other career paths in nursing like did you look at, like what you would want to go into?
There was a time in my life where I thought I was going to do nurse anesthetist and looked into that program and finally was in an area in my life where I could actually do that program. But unfortunately, they were looking for a certain type of student. I didn't qualify for not that I didn't qualify, I wasn't accepted at that time in the program. And then I just really felt like the Lord was maybe leading me into a different direction. I was heavily involved in education early on in my career. I got involved with being an advanced life support or ACLS instructor, PALS instructor. So, I don't know. I think you think that you're going to go down a certain path in your life, and then, you get this like stoppage right there. You're like, oh wow, wait, that's what I thought I was going to do. So I think the Lord just had something else in my life for me, and super glad that I'm on the path that I am right now.
Nice. So let's go back just a little bit. Can you tell me like what your early life was like growing up, high school? What was that like for you?
So I had a great childhood. I'm from a very large family. There's 6 kids. I'm the oldest.
Wow.
So it was a lot of lots of family dinners, lots of people over all the time, a huge support system. I went to a great high school where I met some incredible people and friends, and it was an academic high school, so they really encouraged college. It was pretty much like a college prep high school, so I think they prepared me well for school, especially going to a local JC college. I didn't find that to be very difficult.
Okay. So you were saying that you were in the nursing field for 28 years?
28.
28
Yes.
years, wow. And being in a nursing field or being in any kind of medical field for that long, you've definitely seen and have dealt with some things that have come into your ER, or whatever it is. Can you kind of go into like some things that stuck out to you?
Yeah, I spent, so I've been in the emergency department for 27 out of the 28 years. And so most of my experiences that I've been is all been in the emergency department. I spent 12 years in a trauma center, and I think there's definitely those cases that will always stick with you, right? I mean, I remember a case where, I mean, it was just so awful. We had this awful trauma that a family was hit by a drunk driver, and mother and father both came in, and we were working on both of them and having to call their children to let them know, right? And they were not doing well. And, one was heading to the OR with massive trauma injuries. The other one didn't make it. And I mean, cases like that just stick with you. And, as a nurse, you become, I think, a little bit desensitized over the years of how we deal with things like that. There's support there with your fellow colleagues. They are the only ones that get it because they're in it with you. But yeah, I have so many cases like that there's those few that just really, I'll never forget.
And then how does that, like you said, is like, not a lot of people understand what you go through. Not a lot of people understand, besides your colleagues, of how you get through the day and how you get through those experiences. And I can imagine like how that affects you, like in your personal life. Like when you leave the hospital or when you leave and something like that happens, it doesn't just end there. You go home with it, right? You're thinking about it, or it might affect you like later on. And it's like, what are some of the things that you use? What are some of the things that you do to get past that?
Yeah, I think for me, I pray a lot, right? So I get strength from that. I'm very involved in my family. I have an amazing support system with my family. And I think that's really important to have a support system, whether it's with friends or family that you can connect with, to decompress, take care of yourself, do things, whether it's go on a hike or just whatever, vacations, do whatever you need to try to decompress. I think it's really helpful to kind of talk to people that are in the medical field as well, because everyone has like a story that they want to share. And the more you talk, it's kind of healing in those moments. I think ED nurses or ED staff in general, it doesn't have to be a nurse, we're really good at just stuffing things, right? This is our job. We know what we signed up for. We just do it. And for most of us, I think we can just go through our day. I mean, I love everything about the emergency department. I think there's been a lot of challenges. There's definitely challenges currently. But I still love being part of the emergency department. And, you just figure out a way to deal with it and move on.
Wow. So what are some of like the joys of your job? What is something that like brings you happiness through this career?
Oh, I think there's a few, like the patients for sure. You get to be that person in that patient's life on their worst day. So you get to bring people joy, right? This field is really about a calling. I remember one time I interviewed she was so sweet, this sweet brand new grad looking for a job. And she said, when I talked to her about nursing and why she got into it, and she's like, it is such a privilege to take care of patients. And that just always resonated with me, because really in this field, it is a privilege to take care of people. And that's the mindset that you have to do this. Otherwise, you couldn't get up in the morning and do what we do every single day, right? So definitely the patients, if I can make someone's day just a little bit brighter, that brings me so much joy. The other thing is the people I work with. I think it's so important that you just really surround yourself by really great people. I have a huge team of people with me, and we're doing this job together, and we lean on each other. We're all incredibly hard workers, and it's just amazing to be part of that team.
So going back to like, we talked a little bit about like the joys of the job. Can you like, is there any experiences of when you had a patient come in and it had a good outcome, something that stuck out to you?
Yeah, I mean, there was a time, I delivered a baby in a car, right?
Wow.
And that's a joyous experience,
Wow.
right? And so they're running in the car, and the husband runs in all panicked. My wife's in labor, and you go out and then you catch this baby, right? And you hear that cry for the first time. And no ED nurse wants to deliver a baby, believe me. But but when it's a good outcome like that, and the cord wasn't wrapped around the neck or anything crazy, yeah, those are joyous occasions. When you have just a really super sick patient that comes in and you jump right in on them and you drop those lines in and you get the fluids on board, that meds on board, whatever they need, and you start seeing them turn around. Or even the family members who, are so scared and worried, and then they see their loved ones turning around. I mean, that's where you're like, yes, we did it. Or the stroke patient. I mean, I can tell you tons about our stroke patients who've come in who can't talk, and we give them medication, and you see them right before your eyes starting to speak again and having strength again in their extremities. I mean, that is like, yeah, this is why we do what we do.
That's awesome. So obviously, in the last couple of years we had COVID. COVID happened, and
Yes.
it changed a lot. Changed a lot in the healthcare system, changed a lot for people's, lives and jobs. Can you like kind of go into like how that affected you and your department?
Yeah, it's wild. I've spent a lot of time trying to process what we've gone through in the last, since 2020, and then where we're at today. I remember back in January of 2020 sitting in the cafeteria with my previous director and our director of infection prevention, and we all knew that something was happening. We had heard some buzz stuff about things happening that were emerging out of China with some disease. We really thought at that point it was just going to be a really bad flu season, but we didn't know all the ins and outs. So we started just preparing. We got some supplies in. We started doing some more training with our high fidelity mannequins, and really figuring out what is this that we're going to have to deal with. So we started training way back then, and then COVID hit, and we were learning so much from what other countries that were getting hit hard with this disease. It was a really, kind of a surreal time. I mean, we were converting rooms to make them negative pressure. We were doing all this stuff to protect not only the staff, but then how do we treat these patients and protect the community as well. We were viewed at the time as heroes, which that was a really kind of a weird concept for us, because this is our job. I don't think any one of us really felt like we were heroes, but the community was like, oh, the doctors, the nurses, the techs, everyone that's in healthcare, you guys are our heroes. And so that was kind of weird to try to process that. But, we showed up to work, we got into all the PPE that was required, and we went in these rooms and we took care of these patients. And we did it without their families there, which was a new concept for us too. So that was challenging in and of itself. Families were trusting us that we were going to take the best care of their loved ones that they couldn't see or talk to. And it was really, really hard. I remember one day where this elderly gentleman came in, and he had end-stage cancer, and he was a do not resuscitate. and his wife couldn't come in with him, and she called 911, and so that she knew that she couldn't come in, and she wrote this beautiful letter saying goodbye to her husband of 50 plus years. And I mean, those times, now I'm going to get emotional probably on you, but I'll never forget one of my nurses who literally was in the room reading this letter to this patient from his wife. And of course, all of us who were behind the glass door, had tears in our eyes. And it was just, that moment. And, we eventually contacted the wife, and she was so grateful. And we just explained to her, he did not die alone. We were there right with him, holding his hand. And I mean, it's those types of stories. And she was so grateful. And she wrote us a beautiful letter thanking us for the care that we provided. And so it was a tough time. I think there was a lot of information that was coming across the media, things that were said, some things that were like, gosh, that's not what we're seeing. We're living it. This is what we're seeing. And so it was really hard to try to separate yourself of what was being presented and what our reality at the time was. And, we just all kind of came together and really did the best that we could to take care of the patients at hand. And we had a lot of COVID patients at my facility. Fast forward to what the current state of healthcare is now, it's kind of a shift. There was a lot of information that was out for the public. They're trying to figure out what's right, what's reality, what's real, what's not. They've been really trying to seek care. Hospitals are greatly impacted. Emergency departments are greatly impacted trying to get these patients in. And so this hero concept now has kind of shifted a little bit. And it doesn't feel like we're treated as like these hero concept that we had in the beginning. But I think people are just really broken and kind of wrecked right now and just trying to figure out and process how do we move forward? How do we continue to trust a healthcare system? And when they're having trouble, getting in, and this is like across the country, any medical center that you talk to, they're all saying the same thing. We're trying to get more access for our patients and get people in. COVID really, it impacted a lot of healthcare workers, and people decided like they didn't want to do this anymore, right? So they left the profession, and it's been really hard to navigate that for sure.
Why do you think someone should get into this field? I mean, going through all this, the ups and the downs, why should someone walk into this?
Yeah, I think you have to have a heart to serve, right? You have to have a heart to know that you could be the light into someone's life on their worst day. And I don't think you should go into this profession for the money, because if you do it just for the money, it's not going to be that rewarding. I mean, short term it will, but not for the long term. You really have to do it because you want to make a difference in someone's life. And that's got to be at your core being. And most people that I surround myself, that is why they're there. They want to help patients. They really have a desire to serve in this capacity to make the world better.
Absolutely. So lastly, what do you think, or what piece of advice could you give someone either going to school or thinking about going into this? Like what would you leave with them?
I would say if you want to do it, just do it. Jump in and just do it. It's a great field. It is hard. It's not easy. You're going to have days where you're going to want to quit, and that's okay. But then you're going to have days where you're like, wow, I made a difference. So if anyone's thinking of doing it, I definitely think they absolutely should get into healthcare. I mean, we need really super qualified people that have a heart to do this work.
Awesome. Well, thank you for your time. Thank you so much.
You're welcome.
This means a lot. So thank you.
No problem. Thanks for having me.